Well, welcome everybody. Thank you so much for joining us tonight. My name is Kebie and I'm here in California. And I have the pleasure of introducing our presenter this evening. Her name is Kebie Whitehead. Kebie and I have been in business, multiple businesses in the past, and thankfully we were invited to come to Zort, and now we're here. And tonight, and also I want to mention that Kebie is our U.S. Director of Sales here in the U.S. And she's going to present tonight about our Elite Medical Club. So Kebie, welcome to the call, and you have the floor.
Thank you so much, Lay, and welcome everybody seeing this for the first time. It will blow your mind. I always say you can't unsee it after you do. So welcome all the guests tonight and anybody on the recording. Welcome. My name is Kebie. I am from North Carolina. I have sales and industry experience of networking of over a decade. I always know the number because I started when my second child was in diapers 2 weeks old. So that wasn't really the best time to start a business. But I'm glad that I've hung in here and I've been persistent because it's been very good to me, not only financially, but personal development and including friends like Lay. We actually met through this industry, and she lives in California. I live in North Carolina. So you're able to connect socially and build communities. And that's what we are about here at Zort. Our company is Zort, and part of Zort is that we have products and services we offer people. And one of those services are the Elite Medical Club. We say we're rethinking healthcare. And I just want to take a deep dive into the service. This one alone has me so excited. We have some incredible products and services, but tonight we're going to really focus and drill in on our Elite Medical Club. Our mission through Elite Medical is to provide trusted, simple, affordable solutions that will improve people in the U.S. right now, currently in the U.S., to convenient health care so that we enhance a person's overall well-being. Our vision is that every person in the U.S., and we'll be growing global, but right now we're in the U.S., regardless of circumstances, that you will have access to affordable, simplified health care, resources, and support to live your healthiest life. That is on our Zort.me card, on our websites, everywhere. Our mission, our vision, our values are very important. We are, I believe at Zort, a leading technology company. We are a digital company. We are a virtual community. Through Elite Medical, we are a digital health technology company. And just wait, you'll see it's a little different. Maybe some things you're familiar with that you've been seeing in the industry of healthcare, in the space of your insurance. You may see some things, but you will see a revolutionary product that you can be in the middle of. You could earn rewards to share it and or be a customer. And we're going to go through that. This is not new. Our services have given care to over 2 million patients. It's new to Zort, and this is a new opportunity for us, about a month old. But the services are not new, and that's really good to know because it's not just like a startup that just got started and we hope it works. There are proven concepts, okay? And we're going to go through all that tonight and really catch the vision of what we can do, the power of the service. First, I like to share a testimony. I'm a person that if you want me to sell or share with others, present information to others, I need to use the service. I need to use it, taste it, feel it, have an experience. And I encourage every one of you, if you're going to share the service with people, that you get an experience as well. Okay. So I went and I clicked and ordered the Elite Medical for myself. I had it for a couple weeks. And guess what? Maddox had a cough. He had been sick. We had already been to urgent care before we bought the service. Okay. We went to his pediatrician. He had a persistent cough for literally over 3 weeks. This was around March. Okay. We had nothing but co-pays with an office visit, deductibles, and no answers. There were no medicines prescribed. It was really just get over it. It's flu season, the way it is, the way it goes. So my husband said, "Don't you have that telehealth service? Why don't we use it?" And I'm like, "Let's do it." It was incredible. I went, scheduled an urgent care appointment through through the computer. Okay, click, done. 15 minutes we were seen via phone call. Dr. Prescott called me. She said, "Hey, I'm a little early. Can you talk now?" I'm like, "Sure." It was really, really great. Went over symptoms and the complaints. Maddox was sitting there with us. She put him on an antibiotic, a cough syrup. It was great, all free. This would have cost me $290 to go to urgent care. And it was convenient. I didn't have to sit in a waiting room. We had already been to urgent care twice. My husband waited with Maddox one night, 3 hours in urgent care. So the convenience of not sitting there and waiting on a doctor, no copay, no deductible, and the 2 prescriptions prescribed were free. I had already went to Walgreens. It was called in, and the insurance had a copay of those prescriptions for $49. I said, don't run that insurance today. And I handed them my Elite Medical prescription card, and it was free. It was so turnkey, so easy, so simple. So financially, it was a blessing for our family. Emotionally, it was a blessing because Maddox got better. In fact, the next day after he started his meds that night, he said, Mom, I actually feel good. And that is so rewarding to know that Dr. Prescott listened to me. That's what I'm so excited about, is having a doctor who I like that I can see again, right? Because you can choose the doctors, and if you don't like them, guess what? You can choose another one. And we don't really have that luxury right now in healthcare using insurance day to day. That's been my experience. So let's talk about the benefits of Elite Medical. When you subscribe, you will pick a bundle, a package that makes sense for you. Okay, they start out at $44.90, and our top package is about $65. I'll show you those at the end. So let's just go with $45 a month for service. This is what all you would get for that price. One, primary care. If you need labs, we use Quest Lab. There's no copay, no deductible. You select your doctor. If you don't like your doctor, you can pick another one. It's a virtual visit, either via Zoom or phone call. Okay. And you have an option to choose holistic doctors. So if you want to take more of a natural approach, you can do that as well. So there's a primary care benefit. Secondly, there's an urgent care benefit, just like the one I use with Maddox. You're sick, boom, I need to be seen now. We have an hour response time, which is unheard of. Like I said, I waited 3 hours in the urgent care waiting room. My husband did with Maddox. That's a lot of time, right? Spent in waiting with sick people, other sick people. Here it's all virtual. Another thing I like is that you can schedule your urgent care. So maybe you're at work, you're not feeling good, you're like, oh, I need to be seen, I'm catching something, but you want to do it when you get home. You can schedule your urgent care appointment as well. Okay. Your prescription is called into the pharmacy. They email you your card, your RX card, which is actually inside your dashboard too. But just in case you can't find it, after you see your urgent care provider, they send you the card. It's emailed. You take that to your pharmacy that you choose, okay, and they fill it right there. No copay, no deductible. It's all free. It's so great. Okay, mental health services. We get 12 sessions a year, which is really, really cool. I know my insurance only pays for 3. You can look at yours. Some are paying for none. I have found out that some people have no mental health services. Many people are struggling just to find an in-network doctor. They're 6 months on waiting list. It is crazy. And we need the services. We need therapists. We need counseling when we need it, right? The way it works through Elite Medical is you go in and you say, I want a mental health service, and you have to call a number. When you call the number, they send you an assessment. They kind of triage the issue over the phone to make sure it's not real urgent. Okay. And we literally found we got mental health services in 2 weeks. So that's the turnaround time that it was for us. I feel that's very convenient. That's way better than we've had with our insurance and other providers in our area. So I was so excited about the mental health services here, which are free with Elite Medical Club, because so many people need these services and don't have access. Okay, so another part of our benefits with Elite Medical is our prescription benefit program. There are 1,000 free prescription drugs. There's a list. I will point you to that list here in a couple slides down. But you literally scroll down. It's all in generic, so you might need to like Google your meds, see what that is in generic. That's easy to do. Figure out if your prescription is on that list, and if it is, it's free. So that benefit alone is saving people hundreds, if not thousands, sometimes a month. Okay, depending on the prescription people are on. So when you have insurance, there's still sometimes copays. So if people are out of pocket with prescriptions and they're on this list of free drugs, you can use the service and get those free. And there are also specialty drugs or prescriptions that are up to 20 to 40% off. Okay. If they're not on the list, get back with the person who invited you and we will, check on those for you the best we can. If we have to call Elite Medical, we can get that for you. Okay. So let's say that you subscribe to Elite Medical. The next question frequently asked is who is covered? Okay, well, you're subscribing, so you are covered. You're going to enter your US address, your date of birth, and your email. Okay. When you subscribe to Elite Medical, you will also have a place to enter your spouse or partner with that same US address. Okay. And up to 5 children or dependents who live with you. And if they're in college, 25 and under, that's fine, right? And they're starting at age 2. So that's kind of the criteria. But I've had so many people ask me, is it $45 per person? No. The answer is everybody's covered in your home, okay, with the USA address, children up to 25 years old. That is an incredible benefit, you guys, for families, right? Okay, so just to kind of recap, because I know like I unpack a lot, I just like to let's come back together and talk. This service is available in the US only right now. Okay, so we need a USA address, we need a date of birth. Once you get started and you have any questions, there is a customer service number, and they're open like till 8 o'clock Eastern. So they have pretty long open times. You'll see when you log in what their hours are. And there's an online chat. I know y'all probably use those in other platforms before. You literally click a little button and here comes a chat and there's a person on the other end. So there's a way to get connected for questions. And I feel that's real important because customer service is important. So just know that if you have any questions, there's someone there to help you. Again, this is not insurance. We are supplemental. We're a medical club and there's no copay deductible or anything like that. There's no claims, none of that. Okay, you don't have to worry about any of that. On this screen, it's my little prompt to show you guys actually kind of log in and show you around. We're going to come back. I'm not done presenting, but I want to show y'all our Z Nation Facebook group and the resources there. I want to also show you our Zort.me card. And I'm actually going to log into the medical club, just kind of show you around mine. I'm not going to click too much, but just to kind of give you a visual of how easy the services are. Okay. So first, let's go over to Z Nation. If you're not in our Facebook group, please get in there because under guides, we are adding lots of medical analysis examples. Lauren just posted her latest one. So as we are talking to our friends and family and we see that we're saving people money, we're posting it. So you can see the breakdown of an individual without disclosing too much, right? We're not going to share everybody's medical history, but to give an example of what someone is saving a month. And we can use these stories to share with others to see if this would be a benefit for them. So number one, Z Nation, get there. This is a great place for all of us to view those testimonials, okay? Now we all get a Zort.me card. If you come in as an ambassador, which I hope you do, it's free. There's like nothing to lose on that. Check the box and say, yes, I want to be an ambassador. When you become an ambassador, you will get your own Zort.me card. Our Zort.me cards are literally our resource. They are our information. If you're analytical and after this presentation you need more, you come on right here and open up all these pluses and you will have fun reading into all that we have, okay? But under the prescription benefit program, this is where you're going to find the 1,000, look at that, prescriptions that are free, okay? And it takes a deep dive in our pharmacy plan, mail order, all that good stuff. I believe that when you transfer your meds, you get a 90-day supply. I have not personally done that yet, but I have had a friend who has. So she got her meds, everything went great. So check the list, see if your med is there. Okay. That is under prescription benefit program. Now I'm going to click over here to my Elite Medical. And already, like, this is the screen to log in. And if you have an issue, there's a phone number. Okay, so already there's the customer service number. And once I get logged into my Elite Medical, I have a dashboard. If I need to schedule a visit, here we go. I'm not going to, but let's see what it looks like when it comes up. Right here, just choose a family member. Now, y'all look, guess who's not here? My husband, Jason. This is a good little visual. Here's why. Jason's over 18. He has his own portal. Okay, because we're HIPAA compliant. We're regulated. This is the real deal. This is like what I call the big dog league, right? This is virtual medicine. I have no need to be in his medical record. Okay. He has his own. So just an incredible, I'm telling you, turnkey, just ready to go. Okay. And I'm not going to click on everything, but as you can see, if I want urgent care, I could start a visit, mental health, schedule a visit, call our team 8 to 8. If I want to use the chat right here, it's so simple. Okay. And again, right here's the phone number, and I could add my medications here. I can do all kinds of stuff on this screen. All right. Real easy to use. I know that when I seen the demo for the first time and I seen them pull it up, I'm like, oh, I'm in. So I hope that helps y'all, because I'm a visual person, and I don't know, it really helped me when I seen it. It just showed that it was real, I guess. Okay, let's talk about some testimonials. Again, you'll find these in Z Nation as we grow them. These are true testimonials. These are ones I personally analyzed myself. I literally saved a gal $7,000 a year. Actually, it was Barbara Perry because it was her connection, but Barbara got me involved, and me and Barbara worked it up, and we were just blown away. Actually, the $7,000 a year turned into hold up, let me do the math. 2,259 times 12. I'm sorry, $27,000 a year this lady saved. Okay, so, and some of you met her. She's already shared her testimony for real. Her name is Dawn. She has only really been able to pay in the last probably year or so $600 a month on 2 prescriptions for her heart that she has to have or she would not be here. She can't afford the $2,000 that she needs to be on. There are other prescriptions that she has literally been breaking in half. She said she'd skip a month. Like, it is sad. If you know people doing that, really share this benefit with them, especially if their prescription is on that free list. You will save them money. Not only are you saving them money, but they can actually use their prescriptions right and get the benefit they need out of their prescriptions. Okay. So anyway, it just gets better. We saved her more than $7,000 a year because she can actually take her medications. Okay, so that's Dawn. Another story, the 1560, is my hairdresser. Love her. She's been doing my hair for probably 5 years. And as we were talking, she had bad allergies. She's doing my hair, and I said, "Are you sick? Are you working sick?" She's like, "No, it's my allergies. In North Carolina, it's awful. It's an awful time of the year. Everybody has the allergy stuff, the sinus stuff." But she told me she could not go to the doctor because her insurance was high deductible and she's out of pocket. So she said, "I don't go unless like my eyeballs hanging out." And I'm like, oh my gosh. So while she's doing my hair, I pulled out my phone. I went to my Zort.me card. I asked her, I already knew I'd save her with a doctor's visit, right? But I wanted to know, well, is she on any prescriptions? So I said, look at this list. If you're on any prescriptions while I'm processing, you just scroll through here. And if there's a prescription you take, let me know. I don't want to know the prescription. It was none of my business, right? She said there's 3 on the list. I said, how much do you pay? $130 a month. Okay, so the minute she ordered the service, she was able to go to urgent care, number one, for free, get better, and save $130 a month times 12. I just put back $1,560 in her pocket a year. Okay, so this is what we can do for people, but it's really about having conversations. We've got to pick up the phone with people we care about and ask them, and save them money, show them how we could save them money. All right. And especially if you're watching, we want to see how we can help you and serve you as well. Now, not only helping individuals, we have organizations and businesses we can help as well. I did not know this. I learned something new, but employers, companies, organizations, businesses they actually sometimes pay co-pays for prescriptions and co-pays out of pocket for their employees when they go to the doctor. Okay. I didn't know that. Not all of them do, but some of them do. And in conversations, we've been able to help and do utilization analysis and cost savings analysis for companies. So you could actually take Elite Medical into organizations, people you know that you have relationships with, and see if we can help save them money in addition to their insurance as a supplemental plan. We have two studies here or analysis that involve 96 employees and 1,700 employees. These are true numbers, true cost savings and utilization savings. In 6 months, the company with 96 employees saved $28,000 in copays and deductibles using Elite Medical. Okay. Now, the pharmacy benefit is a cost savings analysis, and for the organization with 1,700 employees, 1,000 of those prescriptions that they pay, 67% of their pharmaceuticals were on that list. Literally, they save $5 million a year. Now, I cannot guarantee that for all businesses. We have to have conversations. So it's up to us to share this with companies and people we know to help them. Okay. So get to those analysis and see what you can save for people. Platform security, you guys, I come from healthcare. You do not have to have a healthcare background to do this. We actually share this with people and get out of the way. In fact, if you have a healthcare background, you're probably more prone to say too much. So it's really good if you don't, to be honest. But what I wanted to know when I got involved is there a HIPAA? Is there HIPAA compliance? Do we have to worry about answering medical questions? The answer is no. Okay, we have a platform security through Elite Medical that we don't need to worry about that. It is regulated and it's designed for security, just like carving out Jason. I don't see his records and so on. Okay. Now there's 3 ways that you can share this. Maybe you're on here as a customer and that's great. But I want to talk about our referral marketing side. I feel like that's very important. There's a huge benefit and upside really just to having a side gig, having an extra stream of income, being able to work this as a business. So there's 3 ways that you could share Elite Medical with others. One is being a customer. Every one of us on this call tonight, I hope we're a customer, okay? But it just means that we go share this with friends and family. If it makes sense to them, you give them your Zort.me card, you're going to earn referral points. They're called club points. You're going to earn those club points and you can redeem those internally or you can withdraw them out in a 1099. Okay. You have a unique link. Your customers click join you, easy. Okay. We all know that model, customers, right? The next model is our sales team. If you love building a team and you want to support people, you want to present like I'm doing, you want a team under you, that's a leverage-based model. When your team gets to work, you help them and you and your team earn club points. That's a referral marketing structure. It goes 9 levels. It's an incredible way to help others, train people, and be a part of a sales team. All right. The other way is business owners. You share this with a business owner, you set that employee up on their medical services, and really you get out of the way. Like there's no training, no onboarding, there's none of that. You get out of the way, Elite Medical takes over, you're going to earn the club points for the referral. Real simple. Also mentioning here that in our referral marketing opportunity, there's no sales quotas. If you guys join as an ambassador and you don't do anything, don't talk to nobody, don't sell it, it's okay. There is nothing to lose here. All right. There are no non-competes. You can do whatever you do. If you sell 5 other things, that's cool. We want you just to share Elite Medical. And if you do, you're going to be rewarded. Okay. There's no contracts for you, your customer, nobody. If people don't like their services, they can cut them off anytime. There's no lock-ins, none of that. There's no onboarding. We do recommend that if you're building a sales team, that you are supporting that team. Right there, we don't require that, but we do recommend it. Here at Zort, we're building a virtual community. We all want to lock arms and help each other. And especially if you get people involved, you want to support those people. Okay. But there's no onboarding or training of our medical. and you never, ever have to answer medical questions. We have customer service for that, which is the Elite Medical Club, okay? And last but not least is I want to share the packages. Before I do, I want to talk about our rebates. We have club points that we earn for referrals, right? Our rebates come back in purchases over $19.95 or more. So if you pick the value solution plan, which is $44.95, you're going to earn 3%. You automatically earn that back. It goes into club points, and you can redeem those internally to purchase other things. You could purchase your medical again with it. Like, it just keeps flowing. It's a great benefit, a great perk. Okay. Once you do join, you're going to use the link the person invited you with, their Zort Me card. You're going to click and create an account in Zort. I hope that you check the box to be an ambassador. After that, you're going to log into your Zort, and then you're going to purchase your Elite Medical plan through the subscription. It's under Managed Subscription. You select it. When that happens, you'll need to wait about 24 hours. You're going to receive an email, and through that email, you're going to create an account to your medical, which is kind of standalone. It's not in Zort. It's your own secure medical, okay? So just knowing that process, give it 24 hours, you're going to receive an email. I do want to highlight really quick the Carefree plan. I'm going to let Pat, if she's still here, kind of close us out tonight. She's big on Quest Lab. She's really had a lot of people use that, and I'd like for her to chime in on it. But the Carefree plan gives you everything. It's our big top pack, all right? It's $64.95. What it will give you is everything I've talked about: the virtual urgent care, primary care, mental care, thousands prescriptions, all right? All that we've already talked about. But it will also include the Quest diagnostics. If you get labs, that's really, really critical for you to get that free. And also the hospital bill eraser. There are raving testimonies about that. People with high hospital bills, this company comes in, they review those bills, they check for errors, they really advocate for us, the patient, to make sure we're being billed correctly, and they've saved people thousands, sometimes I'm not going to say hundreds, but lots. Just go check out some of the testimonials in Z Nation. So with that, I'll stop sharing, and Pat, I'll let you close us out if you will. And thank you everybody for having me tonight. Thank you for being here.
Thank you so much, Kebie. We always appreciate hearing from you, and I love this presentation. It's so simple. You know, we are getting lots of rave reviews on our Elite Medical. I am just so excited. I used it today. I've got a husband going in for an operation on Tuesday, and you know what? It was so easy. This is what I like, is the ease of using, whether it's the the virtual doctor or using the Care Guide Advocate, which is I'm going to be using because it'll be an expensive procedure. And, they're there to help us so fast. They just respond so quickly. And that's what I like, because I don't know about you, it's hard to get answers when you call into the doctor's office. You might not get a call back from your doctor for a couple of days because they're so busy, right? It's flu and cold season right now, and you might never get a call back. And personally, I don't want to go into the office and get sick, right? So everything that we have being virtual makes it accessible for the family. You've got a child that needs to see the doctor right away. So easy. Need a prescription? They'll send it to your pharmacy. You go through the drive-through. You don't even have to go into the store or the pharmacy. So I just love what we have. I hope you take a good look at it. Please get back to the person who invited you to our Zoom tonight. And thank you so much, Kebie, once again, and Lei, for introducing. And we will see you on the call on Monday night. Bye-bye, everyone.